Hello, and welcome to the SHIP Level 1 volunteer training. Thank you for joining us. I am Christine Mather, and I am the Senior Medicare Counselor for SHIP.
And my name is Shay Northfield. I'm the Medicare Counselor for SHIP, and we'll hear from Rebecca Nolfi, our volunteer coordinator, later in today's training. So we asked our colleagues at GNRC what they think of when they hear of the word SHIP. In our word cloud, we see the bigger the word, the more often it was mentioned. So we see helpful, unbiased, knowledge, informative. We also see some words about Medicare that people associate with Medicare. So we see things like confusing, scary, uncharted, labyrinth, understanding. So our goal for today's training is to help give some understanding of both Medicare and our SHIP program, and help you be able to bring that unbiased help to our Medicare beneficiaries. So what is SHIP? So Christine, what is SHIP?
It's a good question, Shay. Lots of people ask us that, and we always put the emphasis on the P there because it stands for the State Health Insurance Assistance Program. And what that means is that we are helping explain Medicare to people in the state that we live in, which is Tennessee. So every single state has a SHIP program, and you can see that it's in all of the U.S. territories as well.
So if I was in Memphis, would I still call the GNRC SHIP?
You would not. There are different regions in every state. In Tennessee, we have 9, and we are the region only for Middle Tennessee. However, we do get people calling us, of course, from other parts of Tennessee, and then we are able to direct them to the correct place.
And what sets SHIP apart from maybe somebody else that's giving information about Medicare?
Yeah, so there are a lot of people out there that are giving information about Medicare. Many of them are insurance agents, and they get commissions when they put somebody in a Medicare program. SHIP instead offers free and unbiased advice. We don't get any rewards for putting somebody in a certain program. Our reward comes from helping people get the best possible information so that they can make the best possible decision for themselves.
Great, so that is a little introduction to what is SHIP. Throughout our training today, we will learn more. So who does SHIP serve? So as you can see, SHIP serves seniors, people 65 and older, people with disabilities, and their caregivers, family members, and also community advocates. So the mission of SHIP is to empower, educate, and assist Medicare eligible individuals, their families, and caregivers through objective outreach, counseling, and training to make informed health insurance decisions that optimize access to care and benefits.
As a level 1 trainee, you will be able to talk to people about SHIP and give them just the basic idea that we can help with Medicare. But we do want you to know what Medicare is. Medicare is a health insurance program, and first and foremost, it is intended to serve people who qualify for this particular insurance because they are either 65 or older than that, or they are under 65 with certain disabilities, or they are any age with end-stage renal disease, or they have Lou Gehrig's disease. So those are the people who are currently eligible for Medicare. I didn't mention earlier, but the SHIP program is funded by the Administration on Community Living. Medicare itself is run by and administered by the Centers for Medicare and Medicaid Services.
So there are 4 different parts of Medicare, and we can see through this graphic that they fall into different categories as well beyond that. So we'll go into more detail, but there is original Medicare. Through that, there's Part A hospital and Part B medical. There is Part D prescription drug coverage, which shows the far right side of this graphic. And then there's an Advantage plan, which is a bundle of Part A, Part B, and Part D. So there are many different decisions to make when a beneficiary will choose their Medicare options. There's 2 main routes. So option 1 would be original Medicare, which is that Part A hospital, Part B medical insurance. then you can choose to add that Part D prescription drug. And some people also choose to add a Medigap, which is supplemental insurance that fills the gap of what Medicare doesn't cover. The second option is that Advantage plan, also called Part C. These plans are typically HMOs or PPOs, and they are a bundle of Part A hospital, Part B medical, and Part D drug coverage. So when a beneficiary is eligible for Medicare for the first time, they enter an initial enrollment period that is a 7-month window that starts 3 months before turning 65, the month you turn 65, or 3 months after you turn 65. So you have 7 months to enroll with no late enrollment penalties. If you were to enroll outside of that window, you could potentially have a penalty attached to your costs.
When someone enrolls in Medicare, there are two parts to original Medicare. Medicare Part A is the hospital coverage part. This is important for people who are inpatients in the hospital. It doesn't cover anything that's done in the hospital unless they are inpatients. So if they are an inpatient, then they also can qualify for skilled nursing care after they've been in the hospital for 3 days. They can have their Part A cover hospice care if they reach the point where further medical care will not prolong life and they just need comfort type care. It also covers blood transfusions, probably because those usually happen in the hospital setting.
And those are enrolled through the Social Security Administration.
Yeah, that's a really important point, Shay. We have a lot of people who are confused about that because they think that, oh, since it's Medicare, I would enroll through Medicare. But no, you need to contact Social Security at the point at which you're ready to enroll in Medicare. And this is for both A and B. Part B is the medical coverage, and it is almost the everything else category. So anything that you are doing that isn't going to take place as an inpatient in a hospital or doesn't have to do with end of life care is going to be under Part B for any sort of primary care, anytime you're seeing a specialist or you're having outpatient therapy of any type, like physical, speech. If you are getting durable medical equipment, and that's like any medical or surgical supplies, crutches, wheelchairs, all those things, anytime you're having a test. Or very importantly, and these are usually free to Medicare beneficiaries, there are a lot of preventative services. Those are covered under Part B as well. And again, both A and B, you enroll through Social Security.
So this is our first review question. It should not have the answer there yet. But this is just a practice round then of what our review will look like for future questions. So the question will come up, which of the following would not fall under Part A? And for the other questions, you can think about what the answer is, maybe write it down, and then we'll find the answer after. This is D, primary care services. That falls under Part B. So Part D, that is our prescription drug coverage. You can think of it as Part D, D as in drug. And these are administered through private insurance companies that are approved by Medicare. So it's a little bit different than Part A and Part B, where if you're on original Medicare, your Medicare card is your insurance card that you would take to the doctor. But when you're on Part D, you'll have a separate card that comes from the private insurance company that you enroll through. That will be your insurance card when you go to the pharmacy. So there are two different ways to get drug coverage. There's that Part D plan, also called a PDP, or prescription drug plan. In order to enroll in a Part D plan, you must have either Parts A or Part B and live in the plan's service area. So if you had a Part D plan in Georgia and then you moved to Tennessee, you would likely need to enroll in a new plan that is within that plan's service area. The other option for Part D is that bundled coverage that we talked about of the Advantage plans. So some Advantage plans come with prescription drug coverage. For Advantage plans, you must have both Part A and Part B. to get those Advantage plans, and also with the plan service area. For these plans, you can't be outside of the United States or incarcerated, and you must be enrolled in a plan to get coverage. When we get questions about Part D, a lot of our questions are around the cost of drugs on these different plans. There are different structures of what the costs will be throughout the year, depending on things like deductibles. That's probably outside of the scope of this training. But one piece of information about the Part D cost structure that we see a lot is something called the coverage gap. So that's a period of time when the cost structure of those drugs changes. It now becomes based off of a percentage of the retail cost. This has recently changed, and it is now that the cost of drug can be no more than 25% of the retail cost. When we're talking about costs of drugs, there are programs to help for those costs for individuals that are low income. So this is called the Low Income Subsidy or Extra Help Program. It is administered through the Social Security Administration, and it helps to pay the Part D plan premiums, deductibles, and lowers the copays, depending on what level of extra help that a beneficiary has. And the eligibility level is depending on 150% of the federal poverty level, which is set every year. For an updated version of what the LIS income guidelines are this year, you can go to gnrc.org/Medicare.
The Medicare savings programs are similar to the Extra Help program in that they can assist people with costs. However, they're administered by the Medicaid program in each state. In the state of Tennessee, that's TennCare. You can see that there are different income-based tiers to help out. And with the qualified Medicare beneficiary tier, which is the most helpful and pays for the Part B premium, the Part A premium, if applicable, they also cover medical services. So a lot of the people who are the poorest people at 100% of the below 100% of the poverty level may qualify for that program. The Special Low Income Medicare Beneficiary Program and the Qualified Individual Program, QI1, and the SLMB, those pay for people whose income is slightly higher. So SLMB is between 101% and 120% of the federal poverty level, and QI1 is between 121% and 135%. However, they only pay for the Part B premium. It's important to note that there are also assets that are looked at. So if you do have money in the bank, if you do have property, they do look at that as well. And those guidelines are also at the GNRC website listed below.
So our next review question is, Medicare Savings Program MSP goes through which agency? Take a moment to answer the question or pause the video. The answer is A, TennCare.
The Medicare Advantage programs that we touched on earlier are a way to bundle together all of your coverages. So this is very similar to the type of insurance that we have here at GNRC for our employees. And it is similar to many people's employee insurance. And so it's something that they're used to and find a little bit easier in some cases. So the Medicare Advantage plan usually bundles together Part A, Part B, and Part D as well. And they're designed for the relatively healthy because there is going to be a copay for pretty much everything. It's often cheaper if you're healthy. They lower monthly premiums. Also, you don't usually have a Part B deductible. So, if you're not doing much in the way of health care during the year, you're probably going to save money for that year. Medicare plan members are still always going to have to pay that Part B if their income and assets mean that they are eligible to pay that Part B. They are going to be in a network, and they are going to perhaps get some extra services like a little bit of dental, vision, hearing, fitness. These all vary from plan to plan, so people have to be very careful that they are getting the providers they want and the services they want. Plans like this don't travel at all well, and if someone is extremely ill, they may well wind up paying up to the maximum, which is about 7,000 or 10,000 per year at the current time.
So we've gotten to our next review question. This is a true or false. Medicare Advantage beneficiaries can go to any provider that accepts Medicare. True or false? Take a moment to answer the question. So the answer is false. Beneficiaries who have a Medicare Advantage plan are limited to the in-network providers, hospitals, and doctors for that given plan. It may be more expensive to go out of network, or they could refuse coverage out of network. So as I mentioned earlier, there is an initial enrollment period for when a beneficiary is turning 65. And that is a 7-month window that starts 3 months prior to turning 65, the month you turn 65, and 3 months after. When you enroll during that period, coverage will begin the first of the month that you turn 65, or if you are somebody who turns 65 on the first day of a month, then it's a little bit different. You actually start your Medicare on the first day of the previous month. So if my birthday was September 1st, my Medicare would actually start on August 1st. There is a general enrollment period, and that is for individuals who miss their initial enrollment period and need to enroll in a plan outside of that window. That is from January 1 to March 31st. The coverage does not begin until July 1st for general enrollment, so it's important to keep in mind that there's potentially a gap from when you sign up for a plan in general enrollment and when it starts. There's also a time every year called open enrollment between October 15th and December 7th, where beneficiaries can make changes to their Part D or Advantage plans. These changes are all effective January 1st of the following year. As GNRC SHIP staff, it's usually our most busy time of the year. We get a lot of calls and paperwork asking to do a plan comparison to see, using the beneficiaries' prescription drug lists and pharmacies, what would be the best plans for them. And so we send out a lot of plan comparisons during this open enrollment period so that beneficiaries have an option to see all their options and decide if they want to stay on their current plan or make a change to a different plan that would start January 1st. So we've gotten to our next review question. During the open enrollment period, again, that's October 15th to December 7th, beneficiaries can change which aspects of their Medicare coverage. Take a moment to answer the question. The answer is D, all of the above. So beneficiaries could make changes to their drug plan for Part D to an Advantage plan, or they could switch from original Medicare to an Advantage plan.
If someone does not choose to go into a Medicare Advantage plan, then they have their original Medicare Part A and Part B. Most of them will also choose to go ahead and get prescription drug coverage through a Part D plan that they can sign up through Medicare.gov. And we at SHIP do help people sign up for both Medicare Advantage plans and Part D plans. But they are not going to be covered for the 20% that Medicare does not pay for. So after you've reached your deductible for your medical expenses for the year, there's still 20% that you are going to have to pay. And if they go into the hospital, there is a sizable deductible for going into the hospital. So because of the uncertainties of that, many people choose to get a supplemental insurance policy. And supplemental insurance policies are not offered by Medicare. However, many private insurance companies do offer them, and they are regulated by Medicare in a somewhat similar way to the Medicare Advantage plans and the Part D drug plans, in that there are rules that these insurance companies have to follow. If you are offering a Medigap plan or a Medicare supplemental insurance policy, as they're also known, then you have to be covering these co-insurance and co-pays and Part A deductible in some combination. There are different plans, but it's determined not by the individual insurance companies, but by Medicare what each plan will cover. Now, this is only an option if you have chosen to stay on original Medicare. You cannot have both a Medigap Medicare supplemental insurance plan and a Medicare Advantage plan. You have to have one or the other. So, why you might choose this one would be if you were traveling around the United States and wanted to be able to do routine care with practitioners all over the United States, or if you always wanted to be able to choose your own doctors, because with original Medicare and a Medigap, you would have the freedom that you have with original Medicare to choose your doctors. You don't have to stay in a network. You can choose anyone who accepts Medicare. Uh, if you are anticipating perhaps being ill in the future, perhaps you have a family history, perhaps you're already having a chronic illness, then this would be another reason to choose a Medigap instead of choosing a Medicare Advantage plan or going just with original Medicare. It's important to realize that there's a limited window for this. So, a Medigap plan during the first 6 months of the open enrollment period, you don't have to have medical underwriting at that point. They can't refuse to sell you a policy and they can't charge you more. You'll see on the slide above, they say if they do find something later on, like if you're not in that 6 months window anymore, they are going to do medical underwriting. They could charge you higher premiums. They could deny you coverage. So it's very important, and that's one of the things that CHIP does, is we let people know that they have this opportunity to get this coverage and that it is a limited time that they have to use the coverage for the Medigap. They can only be sure of getting that coverage during that first 6 months when they have their Part B for the first time. Just like the Medigap coverage, it's important with SHIP to let people know about things that can cost them money in the future. And you can really get in trouble if you don't sign up for Part A and Part B when you are eligible and you don't have creditable coverage. So it is possible to defer your Part A and Part B. Say you're still working and you have insurance. You can stay with that insurance if your company will allow you to do so. You don't have to get your Part A and your Part B, but that insurance has to be as good or better than Medicare insurance. Because if you don't sign up for Part A and Part B, they will assess these penalties. With Part A, it's a temporary penalty, 10%. It's assessed for double the years that you were eligible and did not enroll. And that's 10% of the Part A monthly premium. So it really adds up. For Part B, it's even worse. It's a permanent 10% penalty, and it's for every year eligible that you didn't enroll. So a Part A, the penalties for double the years you didn't enroll. In temporary Part B, it's for every year and never, ever goes away. The Part D penalty is not as high. The 1%, again, is percentage of the premium, which tends to be much lower. However, it's assessed for every single month you were eligible and did not enroll. So it can add up. And again, it is permanent. One of the things that happened in recent years is that they changed the Medicare number, which used to be the Social Security number, and it now is not the Social Security number. It is its own thing. And this is good, and you'll hear more about this in just a moment with the Senior Medicare Patrol reminders. But older beneficiaries may forget that it's not the Social Security number and they may put down the old wrong number.
So the Senior Medicare Patrol, also known as SMP, its goal is to prevent, detect, and report Medicare fraud and fraud. The goal is to empower seniors to prevent healthcare fraud through education and outreach. SHIP works very closely with SMP to be aware that we are following that prevent, detect, report with SMP when we're speaking with beneficiaries and speaking with people who are older adults. So when we talk about SMP, a few things to keep in mind is the difference between fraud and abuse. So the difference between the two is the intent. So fraud is intentional, abuse could be an error, but once there's intent behind it, that is fraud. There are a few different ways to be keeping track of this kind of thing and to be looking out for fraud. One is to be looking at those Medicare summary notices for beneficiaries, to be looking at what the charges are and to make sure that things line up and make sense for what they should be charged for. And similarly with the billing for things like Medicaid and QM. So that is something that we always talk to beneficiaries about, is to looking at those documents and keeping track of everything. On the right, you see an example of a Medicare health insurance card. You'll see the name, the Medicare number, and then the dates of when they started Part A and Part B. SMP will say to treat your Medicare card like a credit card because it does have that important information related to a Medicare account. It's important to keep this number safe and protected. At the bottom, you will see the information for our SMP point person in Tennessee. It is Lonnie Holloway Hitchcock. This is her phone number, and this is the Tennessee SMP hotline. If you ever run into a situation that you think might be fraud, you can call this number or you can refer it to Christine or I or someone in SHIP, and we will report that to SMP.
Before we turn this over, I just wanted to mention that there is going to be a very short test in order to be certified as level 1 and be able to tell people about the wonderful SHIP program and all the good things we do for Medicare beneficiaries. You do have to take a very short, very simple test. It is open material. You can use this PowerPoint while you are taking the test. So you can go back if there are any questions that you have any difficulty with. It's only 10 questions, multiple choice questions.
And you should be receiving the link to the test shortly after watching this video. Again, you can go through this video, pause it at different parts to look at information while you're taking the test. And it's just a way to summarize and wrap up what you've learned during the training, and then also to get that level 1 certification that comes with this training to be SHIP trained. So now we will pass it over to Rebecca Nofi to talk about the volunteer program.
Hi, I'm Rebecca Nofi, GNRC's volunteer coordinator. I'm going to tell you more about what it means to be a volunteer with the SHIP program in this next section. As a GNRC staff member, you may not feel like you are a volunteer, but since you are not paid for your time through the SHIP grant, you are considered an in-kind volunteer to the SHIP program. So if I talk to you as being a volunteer, that's why. And after you've completed this level 1 training and the test, you will be able to help us spread the word about the SHIP program, which is very important to the program, so we can make sure that people can learn about the existence of the SHIP program, and also we can help, you can help us reach our performance measures and goals for the program by spreading the word and referring people to the program. So as a level 1 volunteer, you can always bring flyers and general Medicare information with you to any events with outside partners. If you need any materials, please let us know. We've got several brochures available that we can give to you to take to your partners. You can also help us with administrative tasks. So if there's any mailings or data entry to do, we have to do social media posts and things like that. You could help us depending on what your role is. I know the admin staff often helps us with putting together the large mailings and some data entry, and some others of you might do different things. So wherever you can fit in there. You can also help with Medicare.gov Plan Finder comparisons using the worksheets that we're sending out in the fall. You would not be able to counsel on the actual results. And then, of course, you can refer clients to the SHIP and SMP for counseling. And that will be your biggest role, just sharing that general information. You don't have to go into big detail, just know the basics of the program, and then referring clients to us and then letting people know so they can share with their networks as well. Then I want to highlight just a couple of things from the Volunteer Risk and Program Management Handbook for you. I am assuming here that you have read it and initialed and signed the last 2 pages already, so I will not go over all the details, just highlight a couple of very important things that I want you to keep in mind as you are representing the SHIP program. So all the information given out on behalf of SHIP always needs to be unbiased and free. And then beneficiary information always needs to be kept confidential. So if you are ending up talking to somebody about SHIP that has more detailed questions, just refer them to us or take their phone number so we can reach out to them afterwards and go over any of that more sensitive information. And don't just stop them if they're trying to share that at a more public place, because we want to make sure that that information is kept confidential and secure. You might ask yourself when it's okay to share personal client information. Sometimes it's, of course, necessary to resolve problems that a client may have, or because you may not have all the answers for that specific client. And in that case, in-kind staff or volunteer must have the permission from the Medicare beneficiary. So just go ahead and ask them if it's okay to share their phone number and information with one of the SHIP counselors, and then you can feel free to share that information if they've given you permission. Then reporting is, of course, important, because you can talk all day long to different clients and share about SHIP, but if you don't tell us that you did that, it doesn't count for the program, and so we're missing those contacts that we need. So we ask that you report your hours within a week of contact, which I really recommend, because if you've just talked to somebody or given a presentation and mentioned SHIP, it's still fresh in your memory, and you will remember how many people were there, who you talked to, maybe some of their demographic information. So I really recommend that you just send an email after your event and let us know the details so we can enter it into the STARS for you, which is the system where we record all the contacts. If you don't do it within a week, we ask that at the very latest you do it by the 5th day of the following month. So at the very latest. The reporting, as I said, it helps the SHIP program meet the performance measures, and we all do work really hard. So let's make it count and be sure that we report any interactions that we have, or each time we talk about the SHIP program or do any volunteer work for the program. So you are able to count. If you're having a meeting with somebody else in the SHIP program and you're discussing SHIP, that's a volunteer hour you can count. If you're preparing mail or scanning things for a SHIP volunteer that sends it in as an admin staff, then that's time that you can count. If you are talking at an event about the SHIP program, that's time you can count. Even if you just say, hey, did you all know we have a Medicare counseling program called SHIP, and here's some information, here's the phone number that you can call if you have questions. That's something you can count. Even if you're going out there and you're talking to your neighbor about SHIP and referring them to the program, that's an interaction that can count. So all we need for that is to know who you talk to If you have a name, that's great, but we can also do it without a name. So if we can just record that it's 65-year-old man. He is white and he lives in zip code 37228, then that's something we can record. So just try to get some basic information and information on the place where you talk to them. Then also the SHIP program requires that everybody does some update training to just stay fresh on the information, since there's always changes with the Medicare program. So that update training is 1 to 2 hours each year. And then you also have to take that recertification test on an annual basis. And if you are looking for resources, we have put together a page on our website. It's at gnrc.org SHIP volunteer resources. You can find links to the YouTube channel, requirements for reporting, what you can do with the different volunteer levels, and some other information that can be helpful to you as a SHIP volunteer. And so I encourage you to check that out. And then, of course, we have our volunteer portal, which you've probably heard me talk about a lot, gnrc.org/volunteer. So if you are doing any update training that's not organized by us as a group, just for staff by me, then please record your update training hours through the system. If you can't figure it out or forgot your information, you can email me and I can help you out. So what we'd like you to record is just if you've done any update training hours with the SHIP program in any way, anything that talks about Medicare, and just refresh your memory, any webinars on that, you can just put those hours in under training, and then that can count. We have to report all trainings on a monthly basis in our report. So I ask again that you put that in right after your training, and at the latest by the 5th day of the following month, so we can make sure that that gets on the report and actually counts towards your update hours. Some of the stage webinars, for example, that we have done for some of the aging staff, that would be something that you can count towards your update training hours. If you're not sure regarding the content of any training that you did that you think might be relevant, just send me or Christine share the information, and we can let you know if that is something that can count. And in the volunteer system, you do have the opportunity to upload any certificate or confirmation email of attending with the hour entry as well. If it won't upload for you, please email me those documents so I can save them in your volunteer file. So that's basically everything from the volunteer program that's important to you. If you have any questions, please reach out to Christine, Shay, me, and we will be happy to answer anything for you. And we would really appreciate it if you would take a quick survey at gnrc.org/SHIP training survey. And just let us know what you think about this training. If you have any recommendations of something we can do better, so we would definitely like to improve it and make this as good as it can be for you. So gnrc.org/SHIP training survey. And here again is our contact information. So for Shay, Christine, and me. So please feel free to reach out to either one of us with your questions. I can answer any volunteer-related questions, and Christine and Shay can take care of any other Medicare-related questions for you. Thank you all so much for watching this and participating in the training. You will now be able to take the level 1 test, which will be in here for you to take. And I recommend taking it quickly after the training because information will be fresh in your mind. But if you do have questions before you want to take the test, feel free to do so and reach out. And then we usually ask that you do take the test within 3 days of participating in the training. Thank you all so much. Have a good day.